But do you feel like you are paying more for health care? There's so many reasons why healthcare costs have gone up. And now in a major lawsuit, three major hospital systems are accusing CVS of secretly siphoning hundreds of millions of dollars in drug savings. Let's get into it, because Monday, the lawsuits filed by Mount Sinai in New York, University of Michigan Health and Sparrow Hospital, and the University of Kansas Hospital Authority claimed CVS manipulated reimbursements tied to the federal 340B drug pricing program and kept the difference as profit. Now, this is a bad thing because the scheme alleges that CVS siphoned that money away from hospitals serving vulnerable and uninsured patients. The hospitals allege that insurers and patients basically paid full price for specialty drugs, but CVS later reduced the payments to hospitals through affiliated companies. This then included all of CVS's subsidiaries like Caremark PCS, CVS Specialty, Caremark LLC, and WellPartner. So CVS controls this whole system. And the lawsuits estimate massive financial losses. Mount Sinai is claiming more than $121 million in losses since 2020. University of Michigan and Sparrow allege more than $66 million in losses. And the University of Kansas Hospital Authority alleges nearly $62 million in losses. Ultimately, at the center of these cases is that 340B drug pricing program. And it basically allows hospitals to buy expensive medications at discounted prices and use the savings to help fund community health services. But as a result, because this lawsuit alleges that CVS siphoned that money away, they were not able to use the money for that. A spokesperson for CVS tells Fox Business in an email, quote, "We do not comment on matters that are subject to ongoing litigation and remain focused on serving our customers and executing our business priorities," end quote. So this is something we will continue to keep you updated on.